Hi, my name is Erin and I'm a certified genetic counselor at SDX Labs. In this video, we will review non-invasive prenatal screening, or NIPS. We will cover the difference between screening and diagnostic tests, how NIPS works, the type of information you can learn from NIPS, and possible results. Non-invasive prenatal screening, or NIPS, is a type of blood test that can be done during pregnancy to see if there's an increased risk for certain chromosomal conditions. NIPS is sometimes referred to as non-invasive prenatal testing, or NIPT, or prenatal cell-free DNA screening. Before we dive in any further, it's important to understand that NIPS is a screen, meaning that its role is to identify pregnancies that are at increased risk for certain chromosome conditions, so that those pregnancies may receive further evaluation. While NIPS is highly accurate, it is not intended to definitively say if a pregnancy is or is not affected by a condition. Diagnostic tests also are available in pregnancy to give yes or no answers. Diagnostic procedures are invasive and often occur after a screen result has determined the pregnancy to be at increased risk. Now, let's talk about how NIPS works. Shortly after an egg and a sperm form an embryo, the embryo splits into a portion that will become the baby and a portion that will become the placenta. Because the baby and the placenta both come from the embryo, if a baby has a chromosome problem, we would expect the cells in the placenta to also have that chromosome problem. As a pregnancy develops, cells from the placenta naturally rupture and release their DNA into the pregnant person's bloodstream. These DNA pieces are known as cell-free DNA fragments. In NIPS, a blood sample is taken from the pregnant patient anytime after 10 weeks gestation. The placental cell-free DNA fragments are identified and evaluated to see if there's evidence of any of the chromosome conditions. Because NIPS is just a simple blood test, there is no risk to the patient or the pregnancy. NIPS is typically used to screen for conditions that occur when a baby has 3 copies of a chromosome instead of the typical 2 copies. These are trisomy 21, or Down syndrome, trisomy 18, and trisomy 13. While these conditions could affect any pregnancy, the risk goes up with increasing maternal age. NIPS can also be used to evaluate for other conditions, including sex chromosome abnormalities, extra or missing copies of other chromosomes, or microdeletion syndromes, which are conditions that occur when there's a small missing piece of a chromosome. These conditions tend to be more rare and are not associated with maternal age. When assessing for sex chromosome abnormalities, NIPS can also predict the sex of the baby. Your healthcare provider may or may not routinely order screening for these additional conditions. Be sure to speak with them to know exactly what conditions your NIPS will cover. Next, we'll discuss the possible results from NIPS. Our NIPS report will give a low risk or high risk result for each condition screened. A low risk result means that the screen did not detect evidence of the chromosome abnormality, and your pregnancy is not at increased risk for that condition. A high risk result means that the screen did detect evidence of the chromosome abnormality, and your pregnancy is at increased risk for the condition. Following a high-risk result, a patient and their doctor will discuss exactly what this new risk is, which can vary depending on many factors, including the patient's age, gestational age, and ultrasound findings. A patient and their doctor will also discuss diagnostic tests such as CVS or amniocentesis to get a definitive result. It's important to remember that no irreversible pregnancy management decision should be made based on NIPS results alone. NIPS is the most accurate way to screen a pregnancy for chromosome conditions. Generally, a low-risk result is very reassuring about someone's pregnancy, and a high-risk result should be taken seriously and be referred for follow-up investigations. Although rare, it is possible for the test to give a low-risk result when in fact the pregnancy is affected by the condition. This is known as a false negative. Similarly, it's possible for the test to give a high-risk result when the pregnancy is not affected. This is known as a false positive. Less than 1% of the time, an NIPS test may fail to give any results at all. This could be due to a variety of different factors. In some cases, a patient with a failed NIPS may simply try NIPS again, or they may move on to other types of prenatal genetic testing. Let's review. NIPS is a blood test that can be performed anytime after 10 weeks gestation. NIPS typically screens for trisomy 21, trisomy 18, and trisomy 13, but can also be used to screen for sex chromosome abnormalities, extra or missing copies of other chromosomes, and microdeletion syndromes. Because NIPS is a screen, it can only say if a pregnancy is or is not at increased risk for certain chromosomal conditions. NIPS cannot give a definitive diagnosis and does not screen for all chromosomal abnormalities, genetic conditions, or birth defects. At SDX Labs, we believe in providing patients with the most proactive screening tools available to help patients make informed decisions about their health and the health of their baby. For more information on NIPS, please see the rest of our video library or reach out to us directly.